A chilling new report shows the number of U.S. overdose deaths involving opioids jumped a whopping 21% last year. It comes just as President Trump this week declared the crisis a national public health emergency. The president not releasing any more public funding to fight it, but saying in a speech that the government is already distributing nearly $1 billion in grants to battle the epidemic, and that the focus should now be on getting the right message out to young people.
The fact is, if we can teach young people and people generally not to start, it's really, really easy not to take them. And I think that's going to end up being our most important thing. Really tough, really big, really great advertising.
Dr. Nina Radcliff is a private practice anesthesiologist, joins us now on this very important topic. Dr. Nina, let's start here. How did we get here?
Well, it usually starts off with a legitimate pain. When you come in to see me and you have pain, as a doctor, it's my passion to help you and treat you. It can be arthritis, it can be lower back pain. I want to give you something for that, and oftentimes that has been an opioid prescription. The problem is opioids are addictive, and so after a certain period of time, when your tolerance goes up, you need more, or your doctor says enough is enough, you may turn to buy it illegally on the street, from pills on the street. And when that gets expensive, people unfortunately turn to heroin, which is an IV medication.
So should there be regulations placed on how much and how often doctors prescribe opioids?
And that's what the whole culture of change is happening. There's an awareness that's going about where a number of societies and organizations, there really is a call to see how did we get in this, what can we do differently. We know that just 5 days can cause addiction.
But I mean, you're an anesthesiologist.
I do.
Hear me, so you know very well about what drugs do to the body. I'm asking you, what's the alternative? I mean, why is it that's the first go-to? If I come to you and you've knocked me out, so to speak, and I'm having some sort of surgery, then my doctor says, okay, you're going to have an opioid.
Right.
What are the alternatives?
Well, that's been the culture, and that's where we need to change the culture. We need to look at non-addictive options for pain relief. And I have to say, it's working. I have patients coming to me all the time saying, what else can I do? I don't want to get addicted. Do you have something else for me? And that's what we're doing as a medical field. We do. And that's what we have to work on. We don't have all the answers yet. We need to continue doing it. But I can say that as a healthcare profession, as anesthesiologists, this is what we're looking at. What are different ways to treat it? Is there a nerve block? Can we give more Tylenol? Can we give ibuprofen? Things that are not as harmful or addictive to patients. Because
I know already you can ask for non-opioid medications if you're in the hospital.
Absolutely. And we know it takes just 5 days to cause addiction.
So, oftentimes, Dr. Nina, people succumb to the grips of addiction because of shame. They're afraid to seek help for fear of being judged. For that reason, how effective could a public service ad campaign and the declared public health emergency be? And, you heard the president talk about it. He says, first of all, don't start. But he says we need to talk about this. How helpful could this be if people bring this to the light?
We want to take away the stigma of it. The more you talk about it, you shouldn't be ashamed about it. And public ad campaigns do work. Look at what happened with seat belts. Look at what happened with the anti-smoking. It doesn't happen overnight, but it takes decades and it takes time. And we need to do this, and we need to start now. The best way to deal with the problem is to prevent it in the first place. And we want to aim not at the kids, but everyone in general. And if you do have a problem, to not think that I'm going to lose my job, I'm going to lose my family, I'm going to lose everything. But there has to be other ways to deal with this.
Yeah, and once people realize that they're not the only one, if you suspect that you're a child, although I'd imagine any parent dealing with this, they don't care about what people think. They want to help save their child. But again, there is that stigma, and people do judge. And it's like, it can happen to anybody.
It can happen to anybody.
So don't judge.
Absolutely not. I had a patient just a few weeks back. She has breast cancer, and she's addicted. And she was using the same axis that we're giving her chemotherapy to shoot up IV heroin. And she had an infection going all through her body. I mean, this affects people almost daily. In my practice.
We talked about this a bit in terms of alternative drugs, but a lot of people don't even know that they were even taking opioids.
Right.
Can you tell me what drugs are considered opioids?
Anything that's a narcotic, so anything with codeine, anything with fentanyl, and there's a number of different things. So what I always encourage patients, do your research. Ask your doctor, what are you prescribing?
Okay, but for instance, you just said, medications with codeine or fentanyls, is that right? So how do I know what that is? Like, give me the name brands, or not the name brands, but what is it called?
They're always derivatives, whether it's acetaminophen with codeine, oxycodone. There's different types of medications. But again, you can go online, you can research what it is, and you always want to ask questions when you're getting care. And our doctors, we are educated, our healthcare providers, we are wanting to answer this. And I want to put this in perspective. You know, the opioid epidemic has been a silent epidemic for decades, and I join with many others thanking President Trump for finally taking decisive action. This is something that has been not spoken about, and he's finally speaking out. And this is a first step, and people may be criticizing, but he is the first president to speak out about this. And this has been going on for decades. It's not going to be one thing to solve this entire problem, and people are focusing on the ad campaign, but there's many other facets to what he's proposing.
Dr. Nina Radcliff, always good to see you.
Great to see you.
Thank you very much.
Thank you.